Good morning. Welcome to the Department of Toxic Substances Control, or DTSC's public workshop on the proposal to list nail products containing triphenyl phosphate as a priority product. My name is Chin Xiao, and I'm a public participation specialist with DTSC. On behalf of DTSC, we are glad you are participating today. I would like to introduce our panelists, starting with Robin Christensen, Deputy Director of the Safer Consumer Products Program, Andre Algazi, Branch Manager of the Chemical and Product Evaluation Branch for the Safer Consumer Products Program, Natalie Pham, Senior Toxicologist and Supervisor of the Toxicologist and Exposure Unit for the Safer Consumer Products Program, Tiglath Murad Khan, Environmental Scientist and the Project Manager of the Profile Team, as well as the rest of the core team that are on today. The intention of this workshop is to hear why DTSC is proposing to list nail products containing triphenyl phosphate as a priority product and solicit public feedback. You will have an opportunity to ask questions and give comments after today's presentation. We encourage you to use CalSafer to document your comments. This will help ensure that your comments are accurately recorded and publicly available. Next slide, please. If you have a question or comment during this workshop, please use the Q&A feature to type in your question or comment. Use the raise hand feature if you wish to ask your question or make your comment verbally. For those of you calling in, you may press *9 to raise your hand and press *6 to unmute. We ask that you do not use the chat function. We will answer your questions during the Q&A session. We will take comments during the public comment portion. Next slide, please. Today's agenda includes the introduction and overview, opening remarks by Andre Algazi, Branch Manager of the Chemical and Product Evaluation Branch, Safer Consumer Products, SCP Framework, overview of product chemical profile for nail products containing triphenyl phosphate, presented by Tiglath Murad Khan, a question and answer plus public comment period. Lastly, Andre will give the closing remarks. Today's presentation slides will be available on the Safer Consumer Product, or SCP's workshop and upcoming events webpage. The recording of today's workshop will be posted to the SCP website. Next slide, please. The written public comment period opened on August 1st, 2024, and closes at 11:59 p.m. on September 24th, 2024. The link to profile is listed here, along with the link to submit comments via CalSafer. Next slide, please. Please join me now to welcome Andre Algazi, SCP's Branch Manager of the Chemical and Product Evaluation Branch. Andre?
Thanks, Chin. And good morning, everybody. We're delighted to have you all here for our workshop on our proposal to regulate nail products containing triphenyl phosphate as a priority product. If you've been following our work or have been subscribed to our listserv, you'd likely be aware that our work on nail products has been going on for a long time. In fact, it dates back to 2012, before our regulatory framework was even finalized. And that started with the publication of a report on our study analyzing 25 nail products for hazardous chemicals. Since then, we've continued our focus on the nail products and the nail salon sector due to concerns about exposures, especially among nail salon workers. We've done extensive work in this space with our ongoing collaboration through the Healthy Nail Salon Recognition Work Group. We've published 2 technical reports summarizing our findings from an information call-in and laboratory analysis subsequent to the one we 12 years ago. We've proposed a couple of previous nail products as priority products, specifically methyl methacrylate, toluene, and now triphenyl phosphate. For those of you who've been engaged with our program over the years, you know that public workshops are a vital part of our process and in developing our regulatory proposals, and today is no exception to that. We're here to share our findings and, more importantly, to hear from you I'd like to emphasize that it's crucial that we get your input because we rely on it to fill in gaps and make sure we get our regulatory proposal right. If there are things you think we've missed or misunderstood, or you have new information to share with us, this is your opportunity to tell us today during the comment period and also through written comments using our CalSafer portal. So thanks again for being here, and I'm going to turn it back over to Chin to move to the next item in today's agenda. Thank you.
Next slide, please. Thank you, Andre. I would like to introduce Natalie Pham, SCP Senior Toxicologist, who will be presenting the overview of the Safer Consumer Products Program. Natalie?
Thanks, Chin. Good morning, everyone. I'm Natalie Pham, and I lead the Safer Consumer Products Toxicology and Exposure Unit. Today, I will provide an overview of the SCP regulatory framework, which in its most basic form can be thought of as a 4-step process, as shown in this figure. We follow a formal and rigorous process to identify and address candidate chemicals of concern in consumer products. The first step involves our candidate chemicals list, which is comprised of chemicals identified by authoritative bodies as having hazard traits or potential for exposure. This list is periodically updated, and for the most up-to-date list, please visit our CalSafer website. The second step in our process is the priority product stage. Here we evaluate consumer products for exposure concerns and propose specific priority products based on our research findings. Once a priority product is listed via a formal rulemaking process, responsible entities, REs, must conduct an alternative analysis to determine if there are safer alternatives for the chemicals used in their products. That's step 3 of our framework. Based on the alternative analysis that are submitted to SCP, we then issue a regulatory response, which can include a wide range of actions. Throughout both the alternative analysis and regulatory response stages, we also carry out compliance and enforcement to ensure responsible entities adhere to our regulations. For more details on our regulatory framework, please check the links provided in the chat or visit our CalSafer website. Today's presentation will focus on stage 2, the priority products stage. Next slide. For a selected product chemical combination to move forward to become a priority product within our framework, 2 key criteria must be met. First, the product chemical combination must pose potential exposure. Second, 1 or more exposures to the product chemical combination must have the potential to contribute to or cause significant or widespread adverse impacts on human health or the environment. Once these criteria are met, the product chemical combination can be listed as a priority product through rulemaking. Next slide. This slide provides a closer look into the priority product stage, where we prioritize product chemical combinations. The process involves several steps, starting with initial screening and public engagement on the topic, drafting a product chemical profile, holding a pre-regulatory workshop, as we're doing today, proposing a priority product, and finally initiating rulemaking further down the process. For nail products containing triphenyl phosphate, TPHP, we released our draft product chemical profile on July 31st this past summer, and as I mentioned today, we are conducting our pre-rulemaking workshop. After the workshop, the next steps will include refining our draft profile based on the public comments received, followed by external scientific peer review, ESPER, before we initiate formal rulemaking. All comments received today will be reviewed prior to ESPER. Now I will turn it over to the project manager, Tiglath Moratkin, who will present an overview of our proposed product chemical profile. Tiglath.
Thank you, Natalie. So good morning, everyone. My name is Triphenyl Phosphate, and I'm an environmental scientist at the Safer Consumer Products Program. As Natalie has mentioned, today I'll be presenting an overview of a product chemical profile for nail products containing triphenyl phosphate. Next slide, please. Today's presentation will first start with scope of product and candidate chemical. This will then be followed by a summary of the hazard traits we have identified for triphenyl phosphate. And I'll be referring to triphenyl phosphate as TPHP throughout today's presentation. Then the presentation will be given on exposure potential, followed by a list of some of the potential alternatives that we have identified to TPHP, and end with our proposed alternatives analysis threshold for TPHP in nail products. Next slide, please. There are two main product categories we have defined in our profile that contain TPHP. The first category are nail coatings. Nail coatings are defined as any clear or colored polish, paint, lacquer, enamel, or gel product, which is marketed or sold for application to the fingernails or toenails. Shown on this slide are some examples of products which fall within the nail coatings category. Next slide, please. The second category are nail or cuticle treatments. These are products which are intended to treat the nail or the cuticle region of nails. Products within this category are designed to care for the nail, such as to remove or soften or remove overgrown cuticles. Additionally, these products may be designed to prepare nail surfaces for application of other nail products. Next slide, please. Now we move on to the scope of the candidate chemical, which is TPHP. TPHP is listed as a priority chemical by the California Environmental Contaminant Biomonitoring Program, or Biomonitoring California, which is exclusively an exposure potential list. TPHP is added as a plasticizer in nail coatings and in nail treatments, where it provides flexibility and durability. Additionally, TPHP may be present as a contaminant in nail products. Next slide, please. Although Biomonitoring California lists TPHP as a priority chemical, there are no associated hazard traits. Therefore, we conducted a review of the scientific literature to identify hazard traits as outlined in Chapter 54 of the California Code of Regulations. A link to Chapter 54 is being shared in the chat for additional details. The hazard traits we identified, along with their endpoints, are listed here on the slide. These include strong evidence for hepatotoxicity or liver toxicity due to increased liver weight, and suggestive evidence for endocrine toxicity due to altered thyroid hormone levels. The exposure potential hazard trait of lactational and transplacental transfer of TPHP was also identified, as TPHP has been detected in breast milk and human cord blood samples. Next slide, please. While Biomonitoring California is the only authoritative body listing in our Chapter 55 regulations that has evaluated TPHP, more recently, the European Chemicals Agency has identified TPHP as an endocrine disruptor of concern to aquatic species, and the United States Environmental Protection is currently completing a risk evaluation under the Toxic Substances Control Act. Next slide, please. Regarding the exposure criterion for a priority product listing, our findings indicate that there is a potential for exposure to TPHP in nail products. We have found that nail products and salon services are popular in the United States, with $8.5 billion being spent on professional nail services in 2016. Additionally, according to the Mintel New Global Products Database and MarketLine, in 2019, nail product sales in the United States were between $718.6 million and $2.3 billion. And in California alone, there are approximately 6,100 nail salons with about 128,000 licensed manicurists and approximately 302,000 licensed cosmetologists. Next slide, please. Additionally, our findings have indicated that TPHP has been found in many nail products, including nail polishes, hardeners, enamels, and base coats. Additionally, according to the Mintel New Global Products database, TPHP was listed as an ingredient in 802 formulated nail polishes in the United States. Further, according to our recent information call-in request on nail products, some manufacturers reported TPHP as both an ingredient at concentrations ranging from 0.1% to 10% in nail polishes and UV gel polishes, and as a contaminant at concentrations up to 0.1% in nail polishes and base coats. For more information regarding our recent information call-in request on nail products, you may refer to the link which is being shared in the chat. Next slide, please. The primary exposure route to TPHP in nail products is dermal contact, with studies indicating that TPHP is readily absorbed by the skin. Inhalation is also likely to contribute as well, as there is a potential for TPHP to volatilize from nail products into the air. TPHP has also been detected in the air of nail salons and in the personal breathing zone of nail salon workers. Factors such as poor ventilation, small workspaces, and variable air exchange rates can contribute to increased concentrations in the air, increasing the potential for inhalation exposure to TPHP. Additionally, TPHP is a known developmental toxicant, and transplacental transfer of TPHP to the developing fetus can lead to adverse health outcomes. Following exposure to nail products containing TPHP, an increase in the levels of the metabolite diphenyl phosphate, or DPHP, is observed in the urine, indicating TPHP exposure. Next slide, please. Our findings indicate that exposure to TPHP can adversely impact nail salon workers and nail product consumers. Nail salon workers are considered a sensitive subpopulation, as biomonitoring studies indicate that levels of DPHP increase after a work shift, indicating that nail salon workers have higher exposures to TPHP. Also, nail salon workers can exceed a typical 40-hour work week, and a significant portion of these workers may be of childbearing age, which adds another layer of concern. Additionally, in California, up to 80% of nail salon workers are of Vietnamese descent, and this may create language barriers and limit their access to safety information and personal protective equipment, and their work settings may have inadequate ventilation. Next slide, please. Nail product consumers, which include nail salon customers and at-home users, may also be exposed to TPHP in nail products. Nail salon customers may have similar exposures as nail salon workers, especially in settings with poor ventilation, confined workspaces, and variable air exchange rates, which would increase the inhalation exposure to TPHP concentrations in air. At-home users may also include children, and at-home users may include children, and they are exposed to TPHP because of the following reasons. Either parents use nail products around them, or parents may directly apply nail products on their children. Next slide, please. Next slide. In addition to identifying hazards and exposure to TPHP, our research has also identified several alternatives to TPHP. Shown on this slide are some examples of alternatives that we have identified, and these should be considered in future assessments. Next slide, please. Earlier, we stated that TPHP may be a contaminant in nail products. The pie chart shown here on the right, which summarizes data that manufacturers submitted to us in our recent information call-in on nail products, indicate that TPHP may be present as a contaminant. Therefore, in these cases, our regulations require us to set an alternatives analysis threshold value, or AAT. Manufacturers of nail products containing TPHP below AAT value are exempt from the alternatives analysis requirements specified in our regulations. It is important to note that setting an AAT value is not necessarily a health-based or risk-based determination. For nail products containing TPHP, we propose to set an AAT value of 250 parts per million, or ppm. A short summary of our rationale for setting this AAT value is presented on the next slide. Next slide, please. The figure on this slide summarizes TPHP concentrations detected in nail products from the primary literature, which are depicted as blue dots. The horizontal orange line depicts our proposed AAT value of 250 ppm. Please note that the y-axis, which depicts TPHP concentrations, is a logarithmic scale. According to the data shown in this figure, samples with concentrations closer to 0 are anticipated to be products where TPHP may be present as a contaminant, while higher concentrations are indicative of products where TPHP is present as an intentional ingredient. This data also aligns with TPHP concentrations that were submitted by manufacturers in our recent information call-in request on nail products, which range from 0 to 1000 ppm. Therefore, based on our analysis, we propose to set an AAT value of 250 ppm. Next slide, please. To summarize, TPHP is present in nail coatings and in nail treatments, and nail salon workers and nail product consumers, including children, may be exposed via skin contact or by breathing TPHP that has volatilized from these products into air. TPHP has several toxicological and exposure potential hazard traits, including liver toxicity. For example, animal studies indicate that TPHP may impact the liver and result in changes to metabolic activity and body weight. TPHP has also shown that it can show the exposure potential hazard trait of lactational and transplacental transfer, as TPHP has been detected in breast milk and in human cord blood. Finally, TPHP may be present as a contaminant in nail products. Therefore, we propose to set an AAT of 250 ppm. Our findings indicate that there is a potential for TPHP in nail products to contribute to or cause widespread or adverse impacts. Next slide, please. And so this concludes our presentation. I would like to take a brief moment to acknowledge the many people on our team, including both former and current colleagues. And I also would like to thank our management team for the continuous support and feedback. Next slide, please. I would like to thank you for your attention and for attending this workshop. You may reach out to us at any of the 2 email addresses shown here on the slide. We also invite you we also invite you to visit our CalSafer website to provide written comments on our product chemical profile by September 24. We look forward to reviewing those comments as we continue to further refine our profile prior to initiating rulemaking. I will now turn over the presentation back over to Chin. Thank you.
Thank you, Tig. We will take this time for our Q&A session to answer any clarifying questions before the public comment period. Use the Q&A button at the bottom of your screen to type in your question. If you would like to verbally ask a question, click the raise hand button and we will call on you. Ask one question at a time. We will not be using the chat function. If you are calling in, press *9 to raise your hand and press *6 to unmute. So we have a question from Catherine Porter. Are there any other state or national jurisdictions that have set a threshold limit for TPHP or any of the alternatives to TPHP?
I would like for someone on our management team to take on this question, because I am not aware of this.
I'll take this question, Tig. Hi, I'm Christine Papagni, and I lead our product evaluation unit within the Safer Consumer Products Program. And as far as I'm aware, there are no other state or national threshold limits for TPHP. As to any of the alternatives, there are many alternatives to TPHP. So I wouldn't be able to answer that question live, but you could feel free to follow up with us, Catherine.
Thank you, Christine. Our next question comes from Mary Nguyen. Was there a list of the products that contain TPHP?
So yes, our product chemical profile, there's a table there that contains we list the products and the concentrations of TPHP in those products. If you would like, you can follow up with us and we can provide that list to you.
Thank you, Tig. Any other questions? Feel free to type them in the Q&A tab, or if you're on the phone, press *9 to raise your hand. Catherine Porter, go ahead and unmute yourself and ask your question, please.
Thanks. My question has to do with the alternatives listed for TPHP. And
Catherine, I'm sorry to interrupt. Can you speak a little louder or speak into your microphone, please?
okay, can you hear me now?
Your voice is pretty
better.
faint.
Huh. Okay. Okay, I'm not sure how to handle that, but I'll talk louder. Can you hear me
That's
now?
perfect. Yes.
Okay, so I noticed that one of the alternatives to TPHP is a chemical that's on DTSC's chemical of concern or chemicals candidate chemical list, diethyl hexyl adipate, I believe. And so how does the Safer Consumer Products Program handle that? As far as further down the line in the targeting of only TPHP, are manufacturers then able to use diethyl hexyl adipate instead of TPHP as an alternative? how does that work?
Would you like me to address that question, Tig? Thanks, Catherine. So under our framework, once the assuming we have a priority product listing that has been adopted and is in effect, a manufacturer could choose diethyl hexyl adipate as an alternative, but they would then need to do the alternatives analysis to determine whether or not it's a safer alternative. But we haven't made a determination that it is safe or not safe, safer or not safer than TPHP. And one of my team may want to chime in or not.
Thank you, Andre.
So, but there is more work entailed in choosing something that's on the candidate chemicals list as the alternative to TPHP than choosing something that is not a candidate chemical. I think it's safe to say.
Okay, there's a more rigorous,
Correct.
hopefully, response required.
Right.
Okay, thanks.
Thank you, Andre. We have a question from Michael Maynard. Where can I find the toxicology data?
People can look the profile and look at the references cited there. Go ahead. Sorry, Natalie, whoever was speaking.
Yeah, that's what I was going to say. Hi, my name is Lynn Nakayama Wong. I'm a staff toxicologist at SCP, and the papers that we use to support the hazard trait identification is in the profile in section 4.5.
Right. Thank you, Lynn. Any other questions? No other questions?
I think Catherine has a hand up.
Yes, it's me again.
Yes. Hi, Catherine. Go ahead and ask your
Hi.
question.
So I see that TSFR is also an alternative, and I think at one point the program, Safer Consumer Products program, was thinking about looking into TSFR, and there's reference to it potentially releasing formaldehyde. And as we know, beginning January 1st, formaldehyde is even going to be banned from cosmetics. So is there any movement from the Safer Consumer Products program to move ahead with some further evaluation or further work with TSFR?
We're not currently working on TSFR. We have to, there are a couple of things we need to sort of determine before we would proceed with potentially regulating a chemical. I mean, we could in the future, but we tend to look at things like, the market and how widely used the chemical is, how strong the hazard and exposure data are, and things like that. So that is something that we have done screening on. It did not rise to the top of our priorities at the time. Beauty care and hygiene products are part of our new work plan, so it's conceivable that we might revisit it, but we don't have active work going on with that chemical currently in nail products.
And then I could just add as well that our evaluation with TPHP, it's based on, like Andre had said, it's available data like prevalence, market presence, hazard traits, concentration, and exposure routes from nail products and exposure studies, Catherine. And so that doesn't necessarily mean that there aren't other CCs that could also be harmful, but it just depends on our available resources to prioritize.
I think in general, when we identify alternatives that have sort of like, in this case, that functional use of triphenyl phosphate, as we understand it, is as a plasticizer and a film former, we frequently try to identify available alternatives, but I just, what I didn't really clearly articulate earlier was we don't, by doing that, we're not making a determination that those are necessarily safer alternatives We're just sort of identifying things that would meet or might meet the same functional use criteria. So we're not endorsing or determining that any alternatives we mention are necessarily safer alternatives.
Oh, okay. So I assumed that the list of alternatives were and were ingredients that have been declared by manufacturers or have been found in lab tests of products.
Well, I mean, it's ingredient, finding out ingredient information is challenging. We have a number of ways of doing that.
Yes,
One was through the
certainly
data
know
sets
that.
that we subscribe to, lab testing, the information calling. So yeah, we do, and of course there's reporting requirements, but so the chemicals that we've screened are ones that we had information that were being used. And then among those, since we have, a somewhat limited capacity to evaluate specific product chemical combinations, and since our framework sort of is focused on, individual chemical product combinations, we have to sort of prioritize things that are sort of most impactful.
Yeah, but I guess I was just wanting some clarification on the alternatives that were listed. I assumed that they were alternatives or chemicals that DTSC has either found in nail products during testing, or manufacturers have said that their product has TSFR. Or is that list just a sort of a theoretical list of other chemicals that could be used because they have the same properties?
I'd like the team to speak to that, but my understanding is it's not theoretical. These are used or that, marketed for similar functional use. I see Ephraim has his hand up, so I'm sure he can clarify.
Hi, I'm Ephraim Neworth. I'm another staff toxicologist who's worked on the profile. And I think one of the main resources we use for that is a database we subscribe to where products are picked off of shelves and ingredient lists are screened, and they identify chemicals based upon known functional uses. So they're not theoretical. These are chemicals which the manufacturers put onto the ingredient lists and which are known to have and be used for those specific functions.
Okay, great.
Yeah.
Thank you.
We use other resources too, like just,
Yeah.
Academic and literature studies and things like that as well. Yeah.
Okay, thank you.
You're welcome.
Thank you, team. So we have a raised hand from Doug Raymond. Doug, go ahead and ask your question. Doug, I see you're unmuted. So there you are. You're unmuted. Can you hear us? Doug might be having some difficulties with his mic. Doug, I see that you're unmuted, so you can speak if you can try to Sorry, Doug, when we're not able to hear you. Let's see. Give me 1 second. Well, Doug, if you're trying to ask your question, there should be a prompt on your screen that's asking you to unmute. Okay, you're unmuted, Doug, if you want to ask your question. I don't see any other questions. So we'll just give it a couple more minutes to see if more questions come in. Yeah, I see Doug has typed in. Thank you, Doug. So Doug Raymond asks, what are the next steps after the comments? Timeline. Natalie?
Douglas, you want me to take this? Okay. For the next steps would be to review all the public comments we received today and during the comment period, and then make the necessary updates to our profile. And then we would begin the external peer review science process before we begin to initiate rulemaking. Those are next steps of the process at this point.
Yeah, and then in terms of timeline, we'll be starting external science peer review in October or late October.
And Tig, what is the date that the comment period ends through CalSafer?
It ends on September 24.
Thank
So
you,
we would
Tig.
do public notice for rulemaking next year, maybe the first quarter or second quarter of next year. Is that right?
Yes, that's correct.
Thank you. We have a question from the audience. Are you aware of the CIR report, Safety Assessment for Triphenyl Phosphate as used in cosmetics?
I believe we used that as a reference in the profile. I don't know if anyone else on the team would like to chime in on this.
Yes, we are aware of it, and it is one of the listed references in the profile.
Yes, I concur. That's right. We definitely looked at it and considered it. It's already a number of years out of date in that there's a large amount of ongoing research in the academic and other communities out there. And so new data keeps coming in on the potential toxicities of the chemical.
Thank you, Ephraim. Just waiting for more questions to come in if there are any. So no more questions, looks like. I think we can just go ahead and go straight to the public comment session. Would that be okay?
Yes.
Thank you. So we can bypass, thank you, we can bypass slide 29, slide 30. Okay, so now we're in the public comment session. So we'll use this basically the same tabs for answering your questions, but for the comments. Use the Q&A button at the bottom of your screen to type in your comment. If you would like to verbally state your comment, click the raise hand button and we will call on you. If you're calling in, press *9 to raise your hand and press *6 to unmute. You may also submit comments. Well, you may also submit written comments, via our CalSafer website or email to saferconsumerproducts@dtsc.ca.gov. Keep in mind that the public comment period closes at 11:59 p.m. on September 24. During this live public comment session, we'd like your input on the following questions. Slide 31, please. Is the definition of nail products clear and accurate? Are the GS1 Global Product Classification, GPC codes referenced for nail products relevant and comprehensive? Are there any studies, reports, or primary literature about alternatives to TPHP that we should consider in our proposal? Are there any potential obstacles to adopting alternatives to TPHP in nail products? Is our proposal to set an AAT of 250 parts per million for TPHP in nail products clear? Should we propose a different AAT and why? Are the proposed method performance criteria for meeting the AAT of 250 parts per million clear and complete? I'm not seeing any comments coming in. I'll give it a minute. Catherine Porter, go ahead and unmute and state your comment, please.
Well, it's more a question. So are these questions in the document, in the profile?
So I can take this question. So if you visit our CalSafer portal, for the comment period for this profile, there is an attachment in the on our CalSafer website for the comment period, which has all of the questions. It's separate from the profile.
Okay, thank you.
Thank you, Catherine. Any other public comments? And you can see in the chat tab all the links that we're posting for your reference. Give it one more minute for any more new comments. No new comments. Okay. Next slide, please. We will now end today's public comment session. I would like to I'm sorry, there's something coming in. Michael Maynard, is AAT based on levels in the various products, or is it based on toxicology level?
So is this question based on, is it general for the AAT, or is it based on the AAT for triphenyl phosphate in our products? I'm not sure if I understand.
We can kind of answer that either way, Tig. So, I mean, it can be based, we don't do, our program isn't sort of setting risk-based thresholds. That's not our framework. In this particular case, it is based on measured concentrations or reported measured concentrations in the product, and our sort of determination that below the proposed threshold is likely not intentionally added and probably doesn't have the functional role that people would be adding triphenyl phosphate. So we didn't set the proposed threshold for triphenyl phosphate based on toxicology. It's just based on measured concentrations.
Thank you, Andre. Okay. So let's go ahead and end the public comment session. Andre, would you like to go ahead and give closing remarks?
Yes, thank you, Chin. And thanks everybody for coming to our virtual public workshop today and for your participation. We really do appreciate your input. And as you think about the information we've shared today and look at our draft profile, I strongly encourage you to submit written comments through our CalSafer portal. As I mentioned earlier, the comments we received during these public engagement periods are incredibly important and helpful to us in making sure that we get it as right as we can. So if you would submit written comments by the September 24th deadline, we'd very much appreciate that. And then finally, I'd like to acknowledge and thank all of our staff who worked on this project. And you've heard from some of them today. Especially, I'd like to thank Tiglath Morad Khan for his presentation today, and the entire Nail Products team for their hard and continued work on this and other projects and commitment to advancing this important issue. So we look forward to taking the information that we will gather through this comment period and finalizing our product chemical profile and moving the process forward. So thank you all for your contributions and questions today, and written comments, and especially responses to our questions. So thanks again, and I'll turn it back to Chin.
Okay. Well, thank you everyone for attending. Have a good day. Bye-bye.